It's been a month since you welcomed your new baby into the world. You're supposed to be elated. Instead, you feel sad, lonely, irritable, and depressed. Parenting has its ups and downs, but sometimes the downs start to outweigh the ups, putting a damper on your mood and behavior. This is totally normal, and at least partially due to the hormonal effects of pregnancy, childbirth, and breastfeeding. But when your feelings of sadness persist for several weeks, it could be a sign of postpartum depression. Before we begin, if you are new here, click the subscribe button for more videos like this, and comment below, "I subscribed," so we can welcome you. Postpartum depression is when a woman develops moderate to severe depression after she has given birth. Of course, it is natural to feel sad or down sometimes, and most women will attest to the fact that the hormonal fluctuations that are a natural part of postpartum recovery can lead to brief periods of sadness, crying, frustration, anger, or even regret. In fact, about 70% of women experience what some doctors call the baby blues within a few weeks of giving birth. But, if the low mood sticks around day after day, for at least 2 consecutive weeks, and the symptoms start to interrupt daily activities, it could be a sign of postpartum depression. Women with postpartum depression tend to be chronically exhausted, show irrational fear of harming the baby, or the self being disinterested in the baby, and have extended and intense periods of crying. Postpartum depression is not a sign of failure as a mother, weakness, or a personality problem. It is actually quite common for women to develop postpartum depression. About 10 to 20% of new mothers face this issue, and in the vast majority of cases, it is successfully treated, and tends not to turn into major depressive disorder. Many of the symptoms are similar to those found in major depressive disorder. In addition to feeling down, or having a depressed mood, you may have negative thoughts toward the baby, thoughts of death or suicide, fear of harming the baby, fear of harming the self, irritability, agitation, decreased appetite, difficulty concentrating, confusion, feelings of guilt, regret, or worthlessness, feelings of socially isolation, withdrawal, and trouble sleeping. Some women may only show 1 or 2 of these symptoms, and others may show several over the course of a few days. Sometimes it can be very difficult for a new mother to recognize that she might have postpartum depression, so it is always best to consult a medical professional. Speak with your child's pediatrician about your concerns. Many women are successfully treated with psychological therapy, such as cognitive behavioral therapy, which can provide a mother with strategies and guidance to help them through this difficult time. Sometimes your doctor may choose to give medication in addition to therapy, and some are thought to be safe for breastfeeding mothers. Treatment usually lasts from 3 to 6 months, depending on the severity of symptoms and the mother's progress. Remember that having postpartum depression does not mean that you are not a fantastic and loving mother. Treatment can help them feel that way within themselves, and also help their relationships with others, such as their spouse, friends, and family members. If you think that you might have postpartum depression, or if you are having thoughts of harming yourself or your baby, seek immediate medical. Several homeopathic supplements such as 5-HTP mood support, omega-3 oils, amino acids, or supplements blend several of these ingredients. However, the research on the efficacy of these supplements is mixed, and may or may not be helpful for your situation. Always consult with your doctor before taking any nutritional supplements, and if you are breastfeeding, be sure to also ask your pediatrician. Exercise, getting outdoors, and spending time with other new moms who are going through similar things may also be helpful. There is no single known cause of postpartum depression, and the mother is never to blame. It is not a preventable condition. Hormonal changes, including the dramatic drop in estrogen and progesterone and other hormones, coupled with the intense sleep deprivation of having a newborn, may play a role in the development of postpartum depression. Postpartum depression that isn't treated can weaken your ability to bond with your baby and affect the whole family. Postpartum depression that's not treated can last for months or longer, even turning into a chronic depressive disorder. Even with treatment, postpartum depression can make you more likely to have episodes of depression in the future. When a new mother has depression, the father may be more likely to have depression too. Children of mothers with postpartum depression are more likely to have problems with sleeping and eating, crying more than usual, and delays in language development. If you have a history of depression, tell your doctor as soon as you find out you're pregnant, or if you're planning to become pregnant. Your doctor can monitor you for symptoms. You can manage mild depression symptoms with support groups, counseling, or other therapies. Your doctor may prescribe medications, even while you're pregnant. Your doctor may recommend an early postpartum checkup to look for symptoms of depression. The earlier you're diagnosed, the earlier you can begin treatment. If you have a history of postpartum depression, your doctor may recommend treatment as soon as you have the baby. Here are some tips that can help you cope with bringing home a newborn. Ask for help. Let others know how they can help you. Be realistic about your expectations for yourself and baby. Exercise within the limits of any restrictions your doctor may place on your level of activity. Take a walk and get out of the house for a break. Expect some good days and some bad days. Follow a sensible diet and avoid alcohol and caffeine. Foster the relationship with your partner and make time for each other. Keep in touch with family and friends, don't isolate yourself. Limit visitors when you first go home. Screen phone calls. Sleep or rest when your baby sleeps. Thanks for watching this video, hope to see you in the next video.